My friends, 2,000 years ago, the Jewish tradition argued that two central ideas underlie the ancient Jewish commitment to provide health care to all God's children. The first is Judaism's teaching that an individual human life is of infinite value and its preservation supersedes almost all other considerations. We are constantly commanded not to stand idly by the blood of our neighbors, and this provides a requirement for doctors and communities to heal. And the second is the belief that God has endowed all of us with the understanding and ability to be God's partner in making a better world. And the use of that wisdom to cure illnesses has been a central theme in Jewish thought throughout history. And as a result, a number of relevant healthcare obligations flow from these core values. First, that physicians and societies have an obligation to heal. Second, that patients have an obligation to seek health care. Indeed, the rabbis concluded that Jews should live in cities where doctors live in order to have access to health care. Third, the line from Deuteronomy, "You shall guard your souls," is used to mandate preventive medicine. Fourth, providing health care was not just an obligation for the patient and the doctor, but for societies as well. In many Jewish communities, a public health care system was set up to guarantee that every person, rich and poor, would have access to health care. Fifth, quality of health care was ensured by communal governmental regulation. Sixth, cost containment was ensured. And finally, seventh, that in cases of chronic illnesses, special means of providing funding to cover them had to be provided. Now, all of these helped provide values that speak across the centuries to us today. My friends, when millions of uninsured Americans in need of basic health care pack our emergency rooms instead of doctors' offices or clinics, when health care costs are skyrocketing at alarming rates, threatening the financial well-being of our families and the long-term stability of our national economy, how encouraging to look around here and to know that a remarkable assembly of doctors and hospitals, labor unions, businesses, insurance companies, drug companies, members of Congress, the White House, and as we see today, people of faith, have promised to work together to bring about fundamental and comprehensive health care reform. This is a moment, an opportunity we must not miss. Gathered here today are people from faith traditions across the religious spectrum who share a fundamental belief in the importance of human health and well-being. God did not divide creation between the sick and the well, between those who can afford health care and those who cannot, between those who are entitled to health care and those who are not. God created all of us, endowed us with equal rights, charged us with the responsibility to be partners in the act of healing. So we are here today with the Capitol in view in front of you and the White House just behind you to raise up our moral voice so that every American will someday soon have access to high-quality, affordable health care. Comprehensive, compassionate health care reform must make resources available based on need rather than ability to pay, so no one is forced to live in fear that their coverage will be canceled due to illness or employment. And universal means universal for the rich and the poor, for the old and the young, for the chronically ill and the disabled. And reform must focus on preventive and primary care, saving lives while containing costs. That is why we are here. Our common values mandate us to speak out. My friends, we have the most expensive and the least popular healthcare system amongst the developed nations. Can we do better as a nation? We have the most expensive and the one that spends the most on administrative costs amongst the developed nations. Can we do better as a nation? We have the most expensive and the least comprehensive of the developed countries with tens of millions falling through the cracks. Can we do better as a nation? We have the most expensive and the most children not covered. Can we do better? We have the most expensive and the most confusing and bewildering for consumers and healthcare providers. Can we do better? Well, healthcare reform will be a reality because we have no choice. And the question is, what form will it take? And while that debate rages, our role as a religious community is clear: to remain a goad to the conscience of America as compromises are being made for short-term fiscal expediency, to ensure that we do not abandon the goals of universality, quality, prevention, and cost containment. And let us never give up on that, for we can prevail. And the existing tragic disparities that have existed so long, it is time to say, enough. It will end. It will end now, and we will make it so. We will make healthcare a reality, and we will be the powerful prophetic voice that makes it so.